Welcome back, Dr. Manoj.
Oh, thank you so much. I had a little refreshing time, so now I'm feeling much more rejuvenated.
Lovely. Now, can you just tell us a little bit about yourself, where you studied, and a little bit more about the type of work that you do?
Yeah, of course. I basically belong to Bihar, Patna, which is in India, and I did my basic MBBS and as well as a specialization in general surgery and plastic surgery. Then actually I went to UK in 1991 and I worked there for nearly 10 years before I decided to come back to India. I worked in UK with one of the best hospitals of plastic surgery, where initially I got trained and eventually I was working as a consultant. So in 2000 I came back and I was initially working with the Apollo Hospital in Delhi as a senior consultant plastic surgeon till 2007. And in 2007, there's a hospital group called Max Healthcare. They came up with a plastic surgery department and they offered me to join there as one of the unit heads.
Oh, okay.
So since 2007, I'm working with them in Max Healthcare, Delhi, as the head of department of plastic surgery in one of the hospitals.
Do you have a particular specialty, or are there a number of things that you concentrate on?
I've been doing most of the plastic surgical job, but my particular special interest is in cosmetic surgery of breasts and hair transplant. As you know, we have been talking about that. The aesthetic part as well as the reconstructive part, which often is required in a setup where the patient has got breast cancer and they need a reconstruction to get them back their normalcy.
Just on that, do you, after breast cancer and the surgery that you do on the breast, do the breasts look normal? Where do you, are they, is it a prosthetic?
No, prosthetic is a very simple procedure, but it doesn't give them give the patient their body image back, because they always think that there's something extra added to their body.
Yes.
In plastic surgery, we actually give them the breast tissue almost, I will not say 100%, but near normal, 80-90% normal looking as well as feeling breast.
Now that's, I mean, that must be such a wonderful feeling for them to have,
you know. Apart, I think anybody who has lost a part of the body, to restore it, to give them, and as important as breast, then restoring it and giving them a normal body image feeling. It's a great life changer for them.
Absolutely, yeah. And just going on from that, talking about the liposuction, you just came from one of those surgeries. Can you just explain a little bit about what you do? I mean, my understanding of liposuction is it's painful. There's bruising. Are there new procedures these days that get away from that?
You have asked a very pertinent question, I'll say.
Am I behind the times?
Liposuction is a procedure whereby we mechanically remove fat from the body, and basically this procedure should be limited to people who have got a localized collection of fat. It is not a procedure to make a fat person thin.
Right.
So this is basically to somebody who is maintaining his weight or her weight and have got some so-called stubborn fat in certain part of the body. They can very well be removed by liposuction. Coming to the problems or side effects related to liposuction, the standard liposuction, or as we call it a mechanical liposuction, we actually mechanically break the fat tissue and then suck it out with the help of the liposuction machine. This does cause all those problems like bruising, little tenderness, pain and swelling, and all those things for some time.
Yes.
Although they are temporary, but then still the patient suffers for some time.
Yes.
Now we have got, like any other department, any other specialty, there are always refinement in the surgical techniques with the help of new technology. We have got something called laser technology, which I am using extensively in Delhi. This is a specialized machine. Again, it is ultrasound based. As I told you that in the mechanical liposuction, we have to actually mechanically, physically break the this fat tissue. And
and that's, I mean, that's...
It means a lot of injury,
pushing and shoving,
shoving, right. In ultrasonic based liposuction, in laser technique, the tip of the liposuction cannula has got ultrasonic emitter, and it emits enough to liquefy the fat that comes in its contact. So it's like just like putting knife through butter. It just we put the
so it melts it and then you suck it out, basically.
Suck it out. And the technology is very simple. I'll say very similar to another very common surgery that we do, like for cataract surgery. in cataract, initially people used to have a big cut in the eye to get this lenses removed, which are cataract diseased.
Yes.
Nowadays, what they do, they have got a small ultrasonic cannula. That probe goes into the lens, which has got cataract, and then simply liquefies it and sucks it out. So it can it has made a huge change in the way cataract surgery is done.
Right.
Now we are using the same principle here. This instead of mechanically breaking, this ultrasonic sensor, that it just liquefies them, and then it's sucked out easily. So no more bruising, no more pain, no more.
Right.
The liposuction, although we call it liposuction, is actually liposculpture. We have to remove fat in such a way that we give the curves back to the patient, we remove the fat that is required to be removed, and we leave the fat aside which is not required to be removed.
Yeah.
So it's actually sculpturing. We call it. It should be called liposculpturing. Is a more appropriate word for this. And basically, it requires a lot of skills. You need surgical skills as well as aesthetic sense.
Okay, so is it painful? I mean, is there an anesthetic?
It is a painful procedure because you have to get rid of fat. So for that, the cells are broken. Even with laser, it is a painful procedure. So we need to give some kind of anesthetic. Now, most of the operations, major liposuction, where we typically do upper abdomen, lower abdomen, flanks, buttocks, thighs, and things like that. Sometimes we do upper arm, chin, even cheeks I've done.
Get rid of this, huh?
If it is a small area, yeah, yesterday only I did one on a lady.
Really?
Who had chubby cheeks and a little double chin, and she wanted to, get a normal contour, which I did yesterday actually.
So what sort of downtime would there be afterwards?
Most of the major liposuction patients, they are advised to take rest they don't need hospitalization for more than a day. It's a procedure done as sometimes a day care or at the most 1 day in the hospital.
Okay.
But they are advised to go home and take rest at home. We call it rest at home means they are not supposed to have a bed rest. They just do their normal activities, but they do it gently and stay confined to within the residence so that their activities are limited. The reason for that is, and it's about depending on the patient's own motivation to get back to work. We advise them. Some people are saying, okay, we are ready to take a holiday for a week, then 2 weeks is fine. And some people are keen to go back to work, and for them it's 3 to 5 days of rest at home is enough. After that, they can get back to work because they are almost normal, except that they cannot rush too much, they cannot do any exercises and things like that.
Sure, okay. Well, that's great. Certainly very informative. Now, most of this work you've been doing in Delhi, is that right? Are you bringing it here to...
No, it's very interesting. I'm doing it in good number in Delhi, and of course now I have started my center here, and I've got able support from the Getwell Dr. Kapoor. So we have got a good setup. We are going to grow. We are going to get more elaborate with time. But yes, in Delhi we have been doing all this cosmetic surgery on Indians, but a lot of foreigners, which includes people coming from Middle East, US, Europe, and so on and so forth. In fact, about say 1/3 of our patients are from abroad.
So now that you've started here at Getwell Soundarya, what is your vision? How do you see it growing? How would you like it to proceed?
Well, actually, I got interested in working in Dubai after I had some good company from my friends like Dr. Ashok Kapoor I just now mentioned, and there's another friend of mine, Siddhartha, who's got some business going on here. And also the fact that a lot of patients, when I operate in India, they say, can you come to Dubai? Because it's really easier for me. Some people are from Dubai, some are from other Gulf countries. They would like to. They say, you can come here, can you? Because India is too far. Of course, we know that we get the best of treatment, but still, is it possible? Something like that.
Exactly.
So that made me think about it. But then I got a very good company here, and I found Dr. Ashok Kapoor's setup to be very, very professional and very ethical. And I have found him doing the real work, the quality work, which is what I would be interested to do. So when I got this offer to start Getwell Soundarya with emphasis on aesthetic surgery, both surgical as well as non-surgical, I got a little interested in it. Here, I find that you've got a good life and you've got you have got a opportunity to work in the best of the environment. You can get the whatever best facilities are required.
Yeah.
And that is what my vision is. I eventually want to this Getwell Soundarya to grow as a big center for aesthetic surgery, where every service is available at world-class rate, world-class facilities. If you have got the best of facilities, you can use your skills to the maximum and get the best results.
Of course.
And that gives you real pleasure.
That's really exciting, isn't it? How about when you starting here, are you going to be giving the full complement of procedures, or are you starting with just a couple of them, or?
We have started. We have already started. We are doing most of the common procedures. Very soon we will start what you call daycare procedures.
Okay.
GA daycare, general anesthetic daycare procedures, where we can give a short general anesthesia and do most of the plastic surgical operation. But my ultimate aim, for which Dr. Kapoor's full support is there with me, is to start up a center of a stature where you can give every service related to plastic and aesthetic surgery.
That's really exciting, isn't it? That's fantastic. Well, again, thank you very much for joining us.
You're most welcome.
Yeah.
It was a pleasure talking to you.
Yeah, it was very, very enjoyable. This is Jan Hedman on Aesthetic News, and we'll see you next time.